We're going to now focus on the lower cheek and jawline. Now we're going to aim to put 50 threads along here. We've got a mix here. We're going to use some twin screws and some of the 50mm and the 30mm monos. You could certainly do all 50mm monos along here. The general plan will be roughly 3 rows of 10 coming this way, so vertically, and then we'll crosshatch with about 20 of the monos horizontally. So a mesh pattern will help compress, so that will help tighten that skin up to help improve. And look, you may get some improvement of the jawline, you may get some tightening and improvement in the cheek, but you certainly get an improvement in the skin quality. So we're just going to get started with our twin screws. We're going to come up from the jawline and we're going to end up here, just below, about a centimetre below the corner of the mouth. So aim to place roughly 6 to 8 millimeters apart. If you can get them closer, all the better. And you can see I'm just following the curvature of the skin. We're entering like this and then slowly flattening. Now, twin screws, the thread itself is a little bit wider than your mono, so there's a bit more resistance as it goes through the skin. Just staying superficially. I usually work with 10 threads in my hand, so I know what number I'm working with and how many I've got left. Okay. That's our first row. The second row we can just keep going. That's our next lot of 10. How you go? So that second lot has gone up to here just above the mouth, so now we're going to run our third row just above that, so we're going to enter in about here just beside the mouth. So now that is one of the 30s, so okay, so we've taken our first 3 rows We're now going to come and go across them and we're going to create a mesh pattern of monos, which will help compress the tissue. So we've just got some 30s here, we're going to use those. So for most patients, this area here is the area of concern. The tissue generally is quite tightly bound here, so this doesn't tend to sag too much. It's this area here, so that's where we're going to be putting our mesh across the jowl area of the buccal fat pad. So we've done our first row, which is horizontal. You can see the entry points there. We're just going to come back a little bit and just, again, concentrating on this buccal fat pad jowl area. So there's our first set of threads. It's gone to about there. So we're going to come in here from here. We've done our 50, 30 vertical and 20 horizontal. So that's an easy treatment to do.